As the Indian government is busy battling coronavirus outbreak, a number of citizens and organizations are also not behind in extending their support to the needy people who are worst affected by this pandemic. Be it through distributing essential items or providing ambulance services, they have been contributing their bit without making any discrimination on the basis of caste and community. Similar examples can be witnessed in the Hyderabad city of Telangana, where voluntary organizations have gone an extra mile in fighting the pandemic.
COVID-19 has posed several challenges before the country, deficit in number of ambulances and oxygen cylinders being the major ones. Many people across the country who have succumbed to the deadly coronavirus are dying due to their unavailability. In such a situation, the voluntary organizations in Hyderabad have come to the rescue of COVID-19 patients, no matter which caste or community they belong to. They recently launched 14 ambulances along with a common command room to enable the patients avail their services easily. Equipped with proper equipments and a trained staff, the service is not just meant to transport the COVID-19 patients to hospital, but also to the cremation or burial ground in case any fatality occurs.
Our country and our state also is badly affected with COVID-19. The number of cases, understandably, are increasing day by day. So there is a great need to transport the patients to the hospitals. Alongside, if unfortunate incident of a death happens, so taking them up to the burial ground or the cremation ground also is important. Some facilities are available, but they are not sufficient. Moreover, there is so much of scare, so much of fear in the society. Even the close relations, friends also find it difficult to come forward. And understandably, the instructions also to them are there should not be huge gatherings, big gatherings, etc. In such situation, such voluntary organizations coming forward and making available the vehicles with trained staff, with proper equipment, because the drivers here and the other staff which would be the vehicles, they all have the PPE kits, and then they have been trained how to keep themselves safe and then the others also safe. So it's a laudable step.
The voluntary organizations in the city are not just catering to the ambulance services, but also to other requirements that the COVID-19 patients can have. With many of them undergoing a home isolation and may require oxygen cylinders, but don't have the capacity to buy them, a non-profit organization in the city is making this service available for them. They supply around 12 to 15 cylinders on a daily basis, and till date they have supplied them to more than 120 patients after the online consultation with the doctor.
जो होम आइसोलेटेड पेशेंट्स है, वो पेशेंट्स को पहले हमारे जो काउंसलर्स है वो लोग कॉन्फ्रेंस करते कॉल पेशेंट्स के साथ एंड डॉक्टर, तो पूरा ऑनलाइन कंसल्टेशन ही होता. उसके बाद जो है डॉक्टर पूरा एग्जामिनेशन करते ऑनलाइन, फिर उनको प्रिस्क्राइब करते कि ऑनलाइन ऑक्सीजन थेरेपी देना है, तो वो पेशेंट्स को हम लोग लेके जाके ऑक्सीजन सिलेंडर्स फ्री ऑफ कॉस्ट विदाउट एनी डिपॉजिट हम लोग देते.
Rising above religious biases and working with only motive to serve the humanity, this is what these voluntary organizations have been doing. Their work is inspiration for everyone to come forward and help the country at this time of need.